Hemorrhoids are swollen veins in the lower rectum and anus, common but rarely discussed. They help control bowel movements, but when inflamed by straining, constipation, or pregnancy, they cause pain, itching, and bleeding. There are two types: external, painful under the skin, and internal, usually painless inside the rectum, but can bleed or prolapse. Most cases improve with fiber, water, and over-the-counter treatments. But when hemorrhoids are large, prolapsed, or thrombosed, and conservative treatments fail, surgery may be needed. A hemorrhoidectomy removes the problematic tissue, offering long-term relief. Surgery is considered after a thorough discussion with your doctor, who will assess severity and recommend the best approach. The goal is to restore your quality of life, so you can sit, walk, and use the toilet without pain. While surgery in this area can sound daunting, it's highly effective for those with severe persistent symptoms. For many, it's the definitive end to a chronic, distressing condition. Preparation is key for a safe, successful hemorrhoid surgery. The operating room is sterilized, and the patient is positioned, usually on their back with legs raised or on their stomach with hips elevated. Anesthesia options include general, spinal, or local with sedation chosen for comfort and safety. The surgical team uses specialized tools, scalpels or diathermy pens to cut and seal, forceps, scissors, sutures, and an anoscope for visibility. The area is cleaned with antiseptic, and the team wears sterile gowns and gloves. Every detail is double-checked: patient identity, procedure, and equipment readiness. This meticulous setup minimizes infection risk and ensures precision. Only after all checks are complete does the surgery begin. Careful preparation is the foundation of a successful operation. The conventional hemorrhoidectomy is the gold standard for severe cases. After anesthesia and prep, the surgeon exposes the hemorrhoid using an anoscope or retractor. A precise incision is made around the base, separating the swollen tissue from the muscle. The surgeon carefully dissects the hemorrhoid, preserving healthy tissue. Next, the blood vessels feeding the hemorrhoid are tied off or cauterized to prevent bleeding. The hemorrhoid is then removed entirely. The wound may be stitched closed with dissolvable sutures, closed technique, or left open to heal naturally, open technique. The choice depends on the case and surgeon's preference. Each step is designed to remove the problem tissue while minimizing pain and promoting healing. This method is thorough, with a low risk of recurrence. Recovery can be uncomfortable, but the results are often life-changing. For large internal hemorrhoids, stapled hemorrhoidectomy offers a less painful alternative. Instead of removing hemorrhoids, this technique lifts and secures them back in place using a circular stapling device. The device removes a ring of stretched tissue above the hemorrhoids and staples the area, reducing blood flow and shrinking the hemorrhoids. Performed higher in the anal canal, it targets fewer pain nerves, so recovery is faster and less painful. Most patients return to normal activities within a week. However, it's not suitable for external hemorrhoids or complex cases. There's a slightly higher risk of recurrence and rare complications like rectal narrowing. The choice between stapled and conventional surgery depends on your specific condition and a detailed discussion with your doctor. For many, it's a quicker, less painful path to relief. After surgery, you'll recover in a monitored setting as anesthesia wears off. Pain is managed with medication. The first bowel movement can be daunting, but stool softeners and fluids help ease the process. Most patients go home the same day or after one night. At home, self-care is crucial. Take sitz baths, keep the area clean, and follow your doctor's instructions. Maintain a high-fiber diet and use stool softeners to prevent straining. Recovery takes 2 to 6 weeks, with the first week being the most uncomfortable. Gradually, pain subsides and normal activities can resume. The area heals, and the symptoms that once disrupted daily life disappear. After full recovery, you can sit, move, and live without the pain and embarrassment of severe hemorrhoids. Surgery offers lasting relief and a dramatic improvement in quality of life.